Can a woman with blocked tubes get pregnant? So the fallopian tubes are very narrow, very delicate structures, and the job of the fallopian tube is to pick up the egg which is ovulated from the ovary, and the egg has to be transported through the tube toward the uterus. Now during intercourse, sperm have to swim in through the cervix, up through the uterus and through the fallopian tube. The egg and the sperm meet in the tube such that the embryo is formed in the tube, and then that embryo has to come and implant in the uterus. So the fallopian tubes play an integral part in natural conception. Many women do have blocked or damaged tubes. Now conditions like pelvic inflammatory disease, tuberculosis, sexually transmitted diseases can damage your fallopian tubes. Endometriosis also can lead to blocked tubes because of scar tissue. If you've had a prior pelvic surgery for say a ruptured appendix, for any other GI cause, that also can damage your fallopian tubes. If the fallopian tube damage is minimal, it is sometimes correctable by surgery. But the problem is that the tubes are very narrow and very delicate, and the scarring tissue or the other fibrosis around the tube does not allow a surgical correction to happen. But women with blocked fallopian tubes, of course, have a chance of conception with IVF. In fact, they have one of the best success rates in an IVF cycle. If there is no other infertility factor, meaning if the egg reserve is good, there is no uterine factor, and there are no sperm parameter abnormalities, your chances with IVF are among the best. So women with unhealthy, damaged or blocked fallopian tubes do have a slightly higher risk of having an ectopic pregnancy, whether they conceive naturally or they conceive with IUI or with IVF.